Hello, I am Ajuria Gana-Evi at the Center for Research and Education on Violence Against Women and Children at Western University. On behalf of the Knowledge Ops team, welcome to our first Knowledge Up Presents. The Knowledge Up Presents series features information on trauma and violence-informed research and practice developed by members of the trauma-informed community of practice in their work related to preventing and addressing family violence. First, I'd like to acknowledge that our work is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lempat-Wak, and Chin-Ong-Tong nations. These lands are connected with the London Township and Sabre Treaties of 1796 and the Dish with One Spoon Covenant Wampong. As a settler in this space, I am grateful that I benefit from it in numerous ways and wish to express gratitude to Mother Earth for the resources we're using and to honor all the First Nation, Métis, and Inuit people who have been living on this land for at least 15,000 years. On behalf of the Knowledge Hub, we're happy to be joined today by Mary Motz. Dr. Mary Motz is a clinical psychologist at Mothercraft's Breaking the Circle program and an adjunct faculty in the Department of Psychology at York University. Mary works with infants, young children, and their mothers who are at risk for maladaptive outcomes due to issues related to maternal substance use and mental health difficulties, trauma, family violence, and poverty. In collaboration with Dr. Deborah Pepler, Mary has led the program evaluation and research for the Connections for Breaking the Circles of Violence project. Mary is a member of the trauma-informed community of practice. I'll pass it on to Mary to lead this webinar. Thank you.
Merci. Thank you, Ajiro Gane. I'm just going to switch over to my slides here. And someone will let me know if I don't have things in the right place. Okay. There we go. So, as Ajiro Gane mentioned, my work is through Breaking the Cycle, which is an intervention and children's mental health program. The program is funded by the Public Health Agency of Canada under their Community Action Programs for Children and the Canada Prenatal Nutrition Program. At Breaking the Cycle, we provide a comprehensive range of services to pregnant people and to mothers who have children under the age of 6 and who are struggling with addictions, as well as the many risk factors that co-occur with addictions. You can see here is our list of programs and services. The specific service that I'll be referring to today is our Connections Interpersonal Violence Intervention. Through this presentation, I will use the term community-based projects to refer to the projects that have been funded through the same streams as Breaking the Cycle, and I will use IPV to refer to interpersonal violence. Between the years of 2015 and 2021, we delivered the Building Connections Initiative, which was funded by the Public Health Agency of Canada's Supporting the Health of Survivors of IPV and Child Maltreatment through community programs. The goal of Building Connections was to enhance the capacity of community-based projects across Canada to identify and respond to IPV of mothers who were parenting infants and young children through the delivery of the Connections intervention. So specifically, we developed a 3.5-day training for service providers in 34 communities across Canada to partner with us in the delivery and the evaluation of the Connections IPV group, which was developed at Breaking the Cycle. We also established a weekly community of practice for our partners. We made the decision to partner with other community-based projects which were funded like Breaking the Cycle for a number of reasons. First, these projects were already established in over 600 communities across Canada and engage families who face adverse life events that place the development of their children at risk, including IPV. Community-based projects also offer a range of services, and they have well-established partnerships with other organizations in their community that families require. As a result, we felt confident that with training and support, community-based projects across Canada would have the capacity to partner with us in the delivery and evaluation of an IPV intervention. Our next task was reaching out to community-based projects to establish partnerships for the initiative. So we started that process by developing a free resource manual and delivering a webinar, which was available to all 600 plus projects about how to respond to the needs of families experiencing IPV using trauma-informed frameworks. The webinar included an evaluation survey, which was administered before and after the presentation. And the post-webinar survey included a question about whether participants felt that their project could benefit from more information and training related to IPV. And this is how we gauged interest in participating in the Building Connections initiative. So based on that level of interest, we understood that we would need to develop a systematic and evidence-based selection tool. We were also really mindful about ensuring that partner projects would have the capacity and the support to deliver the Connections group in a manner that would not cause harm for staff or for participants. We used two primary theoretical approaches to guide the development of the tool, specifically trauma-informed practices and relational approaches. Our framework for ensuring that we consider trauma-informed practices came from the work of Nancy Poole and the Center of Excellence for Women's Health. As such, we wanted to ensure that our tool could assess that potential partners had an awareness that IPV is a problem in their community and that they had some need for an intervention, that potential partners had the capacity to build on the strengths, skills, and competencies that they already possessed to work with families in a trauma-informed manner, that partners had connections to other services and supports in their community that offered trauma-informed services for families, and that they had an understanding that physical and emotional safety is of the utmost importance in working with families that have exposure to IPV. From a relational approach, we recognized that the development of and collaboration between people, institutions, and systems occurs through relationships with one another. So we wanted to ensure that our tool would support us in understanding the capacity of community-based projects to apply trauma-informed principles across these important relationships, so that there would be a mitigation of the potential harms in providing IPV services into communities. In order to develop the readiness tool that we required, Breaking the Cycle clinicians who had been delivering connections for over 10 years and researchers from our Building Connections team met to brainstorm some components which would comprise the assessment tool. And together we agreed on a list of 24 components. We classified items as either having the utmost importance, which became our 10 key components. And then we had 14 items, which we agreed would be extremely helpful for projects to have that weren't necessarily mandatory. We also developed a description of the Building Connections initiative so that community-based project staff understood that we were looking for them to partner with us for the duration of the initiative and what that opportunity would mean for their project. Next, we engaged in an iterative process of revising the tool, including modifying and clarifying terminology and organizing the items to separate them into components that would be best addressed by frontline project staff versus those that needed to be addressed by organizational management. We were able to pilot the tool with 5 community-based project sites with whom we had a previous relationship and who had delivered connections previously in their home projects. The scores that we obtained from these 5 pilot projects helped us to know that the tool was providing high scores to projects that we knew already had the capacity to deliver the intervention. Following that pilot phase, we added one additional question, which was a self-assessment of project readiness to participate in the initiative. And we named the tool Your Starting Point Story. This chart, which is in the academic paper that I'll provide you with the reference for at the end of the presentation, shows all of the questions from Your Starting Point Story. You can see where they fell within our theoretical framework, so where they were with respect to trauma-informed practice and relational approaches. And the questions that I have here in bold are the key components for the tool. As I mentioned previously, following their indication of interest in receiving more training related to IPV approaches, staff from community-based projects were sent a copy of the Your Starting Point Story tool, which included a description of the Building Connections initiative and opportunities for collaboration. When multiple staff at one project expressed interest, we encouraged them to complete the tool together along with their project manager. Next, I will present the findings from the study where we conducted a really preliminary validation of Your Starting Point Story, and I'll share what we learned about the utility of the tool. In the months following the webinar that we presented, we received 38 Your Starting Point Story protocols from 33 community-based projects. The tool was scored based on our previously outlined protocol, where items received a 0, 1, or a 2, based on whether the item was included, partially included, or not included. We had 2 researchers rate the protocols independently, and we had good reliability between the 2 of them. The scoring key for the tool is available in the academic paper. And from this initial group of 18 community-based projects, from this initial group that sent us the Starting Point Story tool, we accepted 18 of the community-based projects into the initiative, and 15 were ultimately not accepted. So the table here shows the scores from the key components, recommended components, and total scores of the community-based projects which were accepted and not accepted to partner with us from that initial group. For the projects who are not invited for further participation, we did offer to provide feedback about the scoring of Your Starting Point Story and to describe ways in which their project was not at that point able to identify and demonstrate the level of readiness that we felt was required for this initiative. But we did invite projects to reapply over the course of the initiative if there was a change that would increase their level of readiness. There were 3 ways in which we made attempts to validate the constructs that we developed for Your Starting Point Story. This included expert opinion, uptake, and implementation, as well as response and feedback from community-based projects. Our expert was Margaret Leslie, who is the Director of Early Intervention Programs at Mothercraft and the author of the resource manual about implementing trauma-informed practices into community-based projects that we disseminated at the beginning of the initiative to all projects. Margaret has been involved with the delivery of early intervention services for families for over 30 years and is recognized as a leader in the field. And her ratings of Your Starting Point Story applications were made independently of researchers, and she was in 100% agreement with the partners that were selected for Building Connections. In regards to implementation and uptake, of the 18 community-based projects who were initially invited to partner with us based on their Your Starting Point Story results, 16 of them dedicated 2 staff members and completed the training. It was a 3.5-day training that was offered at Breaking the Cycle in Toronto. And within 18 months of the training, 14 of those groups had delivered connections in their home community on at least one occasion, with many having delivered the group multiple times. Finally, we received feedback from community-based project staff about the utility and the importance of your starting point story after they received the training from us. And staff said that they appreciated the fact that we had explicit goals around the need for projects to have capacity to deliver sensitive trauma-informed programming. They also understood why the elements on the tool were chosen and how those elements related to the project's capacity to deliver the connections intervention in a manner that was safe for both their staff and for their clients. We also heard from some projects who were ultimately not selected to partner with us on building connections. And some of those staff reported that having a chance to complete your starting point story and to review it with their teams and management was helpful to understand the needs of their project and to develop future plans for their project to incorporate trauma-informed frameworks. So for that reason, we believe that the Your Starting Point Story tool can assess organizational readiness to provide trauma-informed interventions for families with infants and young children, and those specifically those who have complex needs, and that it has the capacity to be used by researchers, program developers, and practitioners to form effective collaborations. We feel that Your Starting Point Story has the potential to be used as a self-reflection tool for community-based project staff to consider organizational structure around trauma-informed practices and whether they want to take the opportunity to make changes to include supports for their staff and for their families. So here is the reference for the paper that contains the Your Starting Point Story tool and the scoring key that I referred to earlier. And I think it looks like that I'm pretty close to the end of my time. So I'm going to stop here, but I'm going to thank you very much for being with me today. I really appreciate your interest in our work, and I'm happy to respond to questions.
Thank you very much, Dr. Mary Motz. We will pass on some questions that have come in. It will alternate between myself and my colleague in both English and French. So I hope you turned on your interpretation. Oh, perfect. Okay, so the first question that I have is could you discuss some of the challenges or obstacles that were encountered during the program evaluation and research process, as well as how you've addressed them, like out of the literature. So when it comes to the direct practice work, what are some of those challenges that are being addressed following the evaluation that you've just completed?
So are you talking about like the entire initiative that we—
Correct.
Oh, okay. I was, that's a really great question. I wasn't prepared for that one. From that initiative in particular, to be honest, we had a lot of successes. And if people want to go to the mothercraft.ca website, there's a link called Building Connections. Our final report, which is quite comprehensive, is available at that website. And it discusses our methodology, the entire project, all of our tools, all of our results. And so if people are, have sort of a deeper interest in building connections, you can find that information there. Like I said, that initiative did complete in 2021. Probably the trickiest part was that the data collection ended quite abruptly in March 2020, as you can imagine. And for some of the projects that we were partnering with at that time, they were in the process of delivering the connections group. And so, that stopped. And our recommendation moving forward was that connections was not a group that could be delivered effectively virtually. So I think that, that it, because of the nature of an interpersonal violence group, and a group specifically meant for mothers of infants and young children, it just didn't lend itself to being a virtual intervention where children or potentially abusive partners were in the home with women when they were trying to receive the group. So I think that, when I think about what was hard about the group, I think that was a hard part about the initiative.
Thank you. Well said. You were prepared. That was great. Thank
Well,
you.
I don't know. Thank you.
Sabri.
Thank you. Thank you. Merci beaucoup, Marie, pour ta présentation.
Thank you very much, Mary, for your presentation. So the next question pertains more to the projects that were not retained or not selected. So in your presentation, you said that you gave them the opportunity to resubmit. But what we would like to know is, what were the reasons for projects being rejected? So you said 15 projects were not accepted. Could you elaborate on that, please, on the reasons?
Yeah, I can for sure. So and it really has to do with what those mandatory components were that I referred to earlier in the presentation. And those components were based on the fact that we needed to know that there would be safety for both the staff and for the participants in the group. Knowing that interpersonal violence is a difficult topic all the time, but especially when you're thinking about mothers of infants and young children, and what potentially that home environment could be or might be. And so, we needed to know that projects had at least some form of relationships in their community with women's shelters, with other trauma counseling programs, with child welfare services, so that if these, because the CAPC and CPNP projects that, where these, where connections was being delivered, they're not like clinical programs, right? They're not programs where people are psychologists and psychiatrists, and they're community-based workers. So we needed to ensure that there was a system of support that surrounded these projects. So when difficult issues would come up for these families, that they weren't left in a lurch, and that people had safe places to access information and to access support for families. So when those kind of frameworks weren't in place, we just didn't feel like it was responsible for us to expect that there was going to be delivery of this intervention when we didn't feel like it could be done in a safe way. So I'm going to tell you that the Connections Intervention Manual is available on the mothercraft.ca website, as I mentioned before. There is a version of it in English, in French, and a version that was adapted for Indigenous communities by a organization here in Toronto, and it's available for everybody. So anybody can go and access these manuals and deliver the group. For this initiative in particular, our responsibility was to make sure that we were providing the information with systematically and with fidelity, and that we were evaluating it. And so we just had to ensure that there were different systems of support around that when there were expectations of the delivery. Does that answer the question, do you think, Sabri?
Oui, ça répond super bien à la question. Puis ça
Yes, you've
m'amène.
answered super well. And this brings me to another small question. So these projects that were not accepted, was there a way where you could offer consultations or counseling or help them to fill out their next request, or if they want to register in your program, for example?
Yeah. So, and we did do that, right? We offered opportunity for feedback about, so what was where was that decision point made? What were the points where we felt like, you know, that they needed more support, right? And we did offer to, you know, even talk to their organizational management if that was helpful, to provide concrete examples if that was helpful, to you know, give them more information about how our organization works and how we put those pieces together. We actually, you know, we have quite close relationships, even with some of those projects that weren't ultimately involved in the initiative. And it was really a pleasure to be able to work with them as well. So yes, that was for sure a part of what we did.
Merci beaucoup, Marie. Merci.
Merci.
I have a question. I know you've, thank you for answering our questions thus far. You've spoken to the intersection of the work when it comes to shelter, child welfare, and counseling agencies. You also discussed the piece around manuals that are culturally inclusive for Indigenous families or Indigenous persons. So I was just curious, considering that these are manuals that are readily available for individuals or maybe professionals to go and utilize in their support to parents and the children, have you received any feedback as to how that is being done? Are they able to look back with you? So there's professionals who utilize the tools, especially from that culturally inclusive approach. Are there any feedbacks? Do they follow up with you or your team? Any thoughts on what that process is like?
So we've definitely had connection with people who we know have accessed the manuals from the Mothercraft website and let us know how they've used them and where they've used them. So for example, I believe it was near Ottawa, there was a group who were using it as a part of a child custody assessment. So we're going to be running the group like through a court situation. And the 5 pilot project sites that I talked about earlier were all people that, you know, this was before the initiative. They had knowledge of the connections group and had run the group in their community, and so got back to us about that. And that's how, you know, we connected with them to be the pilot site. So you know, I did a training in Australia, in Melbourne. Poor me, I had to go to Melbourne for a week to provide some training to a group there who were very interested in being trained in connections. So we're, you know, I think my email address is on the website with the manual. So we're really open and happy to hear about people's use of the intervention. It's the reason why we have made it available to the public and for free, is because we feel like everybody should have that access to that knowledge and information, and so it's open for people to use. And I'm always happy to talk to people. You can see that.
Thank you very much. Can I ask a quick follow-up to that too? Just going back to, I'm not sure, I'm guessing we may have a few people from that child welfare sector knowing, again, the big intersection for families when it comes to recording cases of neglect or supervision or child abuse. What is the experience like, or the uptake with child welfare professionals in particular, with the tools or even the recommendations in terms of the support that is available?
Yeah, so first I'll speak personally for our families here at Breaking the Cycle. And many of our families are have child welfare involvement. And so I know from our child welfare partners that they're always happy to hear that families are able to access an interpersonal violence intervention, and that's part of their system of support and of work that they receive here. Because I do know, at least, again, I can only speak for the child welfare services in Toronto, but that is a priority for them to support families around interpersonal violence supports and interventions. And then I also know from our partners across Canada that child welfare has been a big referrer to them for the group. So there has been great interest in the child welfare sector about making sure that that families do have support. And I think that it's they like knowing that it's not just a group that's offered sort of on the side with no other connections or systems involved with it, that they know that, you know, families are going to a center and they're having lunch and they're receiving an intervention, and then they're talking to a support worker who can connect them in the community to different services. And I think that that community approach is consistent with where many child welfare services are right now.
Excellent. Thank you. Thank you very much. I'm not sure if my colleague has one more French question, but those are all the questions from the English sector. Okay. All right.
Yeah, I don't have other questions, but I think it's all the time that we have for today for the knowledge present.
Mhm.
Thank you so much, Mary, for your presentation. I'll let you close, Jirogane.
Absolutely. So thank you to everyone who's tuned in today. Watch out for our next one. But most importantly, thank you, Dr. Mary Motz, for your expertise, your time, and for answering these questions so eloquently. Thank you. We will have to all go and check out these resources and utilize them in our different spaces. Again, thank you for spending your afternoon with us.
Merci, Sabrine, Jirogane. I appreciate it.